We're going to discuss the normal histology of esophagus and stomach with diagnostic and clinical relevance. The gastrointestinal tract is a hollow tube which is composed of a central lumen covered by mucosa, submucosa, muscularis, and serosa. This is true for most of the parts of the gastrointestinal tract. However, there are a few exceptions. For example, in esophagus, there is no serosa. Instead, an adventitia is what? Oh, come, sucking. Fuck me, man. God damn. Let us discuss the normal histology of esophagus and stomach with diagnostic as well as clinical relevance. The gastrointestinal tract is a hollow tube-like structure which has a central lumen, mucosa, submucosa, muscularis, and serosa. This is true for most parts of the gastrointestinal tract. However, there are a few exceptions. For example, in the esophagus, there is no serosa. Instead, there is an adventitia. The serosa is a visceral peritoneal covering. However, the adventitia is just a connective tissue which supports the esophagus. The mucosa, as you can see here, is a stratified non-keratinized squamous epithelium. A submucosa, a muscularis externa, is present. The submucosa has submucosal glands along with submucosal ducts. Because there is no serosa in the esophagus, it's more prone to mediastinal spread of infections from the esophagus or into the esophagus and direct spread of tumors, making the esophageal tumors difficult for dissection. Sometimes when the biopsy is deeper, submucosal glands can be biopsied. This may lead to a false impression that there are presence of glands in the esophagus, leading to a misdiagnosis of either ectopic gastric glands or even Barrett's esophagus. So, how to differentiate ectopic gastric glands from the submucosal glands of the esophagus? When a PAS with Alcian blue staining is done at a pH of 2.5, the submucosal glands of the esophagus stain purple in color because of its acidic mucin. However, gastric glands stain magenta in color because of its neutral mucin. This is the epithelium of the esophagus, a stratified squamous epithelium. Normally, the vascular papillae, as you can see here, is restricted to the lower 1/3 of the esophagus. However, when it extends to more than 50% of the epithelium, cases of gastroesophageal reflux disease should be considered. Now, let's overview the stomach. The stomach has a surface epithelium which is almost always composed of foveolar cells which secrete mucin, and this is what comprises of the majority of gastric pit. Gastric glands are composed of 3 types of cells, which are parietal cells, chief cells, and endocrine cells. There is a muscularis mucosae, like in all the gastrointestinal tract. The muscularis externa is composed of 3 layers instead of 2, which are usually present in the rest of the gastrointestinal tract. An additional oblique layer is present in the stomach. Serosa is also present in the stomach as an outermost covering. Parts of the stomach have unique histology. We'll discuss one by one. Cardia of the stomach has prominent lamina propria, which has prominent lymphoplasmacytic inflammation, which is normal considering the cardia of the stomach. This is important to know to avoid a misdiagnosis of chronic gastritis. Fundus or body of the stomach has foveolar cells, 2 gastric glands, and the ratio is 1:3 because, as you can see in this image, gastric glands are way more compared to the foveolar or gastric pits. Why is it important to know this? It is important to know this because biopsies which are received for H. pylori, an organism which is present in the antrum most commonly, now they might not be present in the fundus of the stomach. So, if you get a biopsy from the fundus of the stomach and not the antrum for H. pylori, then there are high chances that you might not find organism or any related changes. These are the parietal cells. The parietal cells have very eosinophilic cytoplasm, round nucleus, and a prominent nucleoli. The chief cells have a fairly basophilic cytoplasm and are smaller in size when compared to the parietal cells. These are the endocrine cells, and these cells may or may not be seen clearly in histology, and sometimes IHC such as cyanoptophysin and chromogranin may be necessary for their identification. The mucous cells or the mucus cap cells secrete mucin. Parietal cells, which are also known as oxyntic cells, secrete hydrochloric acid and an important intrinsic factor which is responsible for vitamin B12 absorption. Chief cells secrete pepsinogen. The function of this pepsinogen is with the help of hydrochloric acid, they break down protein molecules into peptides. Endocrine cells are of three types. The enterochromaffin cells, which are responsible for the production of serotonin, are present in all parts of the stomach. The enterochromaffin-like cells, which predominantly produce histamine, are present exclusively or concentrated in the body of the stomach. G cells, which secrete gastrin, however, are exclusive to the antrum of the stomach. We'll be looking at its clinical significance in a while. Antrum of the stomach. Now you can see compared to body of the stomach, the gastric glands versus pit ratio or the pit versus gland ratio is 3:1, since gastric pits are far more concentrated in the antrum of the stomach and gastric glands are far fewer in number. Also, you can note the presence of parietal cells which are not very concentrated in the antrum, the presence of parietal and chief cells which were present in the gastric fundus or the body. So H. pylori is an organism which preferentially resides in the antrum of the stomach, and usually you get an antral biopsy to identify these organisms. What is the significance of endocrine cells? You can see in autoimmune gastritis, the pathophysiology of autoimmune gastritis being antibodies towards parietal cells, there is significant destruction of parietal cells, giving it an appearance of antralization. When even though this biopsy, even though is from the body of the stomach, it gives an appearance that this is from the antrum of the stomach because of significant lack of parietal cells and oxyntic cells and increase in foveolar cells. So this is a problem. There is a way to find out. How? By doing a gastrin immunostain. As I already mentioned, that gastrin or G cells producing G cells which produce gastrin are concentrated in the antrum and not present in the body. So when you do a gastrin or a immunostain to identify the G cells, you can see presence of G cells like this, and when you see this, the biopsy is an antral biopsy. However, in contrast, when there are no G cells staining, then it could be a biopsy from the body, and it could be a case of autoimmune gastritis which has undergone antralization. So in conclusion, recognition of the site of biopsy is important in diagnostic standpoint because H. pylori, which predominates the antrum, may be missed if a biopsy from the fundus of the body is received, and also if a biopsy from the cardia is received, it may be mislabeled as chronic gastritis because of the natural presence of lamina propria and its inflammatory infiltrates. Atrophic and autoimmune gastritis affects the body of the fundus, so you might get a biopsy which might resemble an antrum. So these are the reasons you have to know the normal histology of stomach and the various differences in them. Thank you.